There's been a great deal of discussion about repealing and replacing Obamacare for years. The reality is this is a very complex bill, and it's going to be really important to think about how we can effectively transition the industry into any new approach that is going to be taken under the Trump administration. To make any change, when you think about having long-term sustainability, it's important to have bipartisan support. They now have an opportunity. It's incumbent on them, though, to come up with some new alternatives that can not only start to change the cost trajectory, but can also provide the comfort to millions of Americans who may have just been granted access to healthcare coverage. Another thing that we'll need to consider is, once changes are made at the federal level, what are the states going to need to do? Depending on what changes are made to Medicaid, depending on whether or not they remove some of the federal rules around essential health benefits, plan designs, cost-sharing limits, what will the states need to act on? And what course will they each need to take? And what's their time frame? Currently, right now, we're in the open enrollment period. Many are choosing their health plans for 2017, whether they're in Medicare, purchasing on the exchanges, or in the individual market. If the Trump administration and Congress moves forward with some changes in the first 100 days, will those changes go into effect immediately? They're certainly focused on finding opportunities to reduce high premium costs that many Americans are concerned about right now. But can they really implement those changes mid-year? Or what approach are they going to take to make sure that they can create that sustainable change that is really going to provide the best benefit to the most Americans? One other point to mention is that we expect that there's going to be continued emphasis on cost transparency. The Trump administration has indicated that cost transparency is one of its goals. We know that this is a continued struggle and frustration for many Americans. Consumers have very little insight, if ever, when they visit a clinician in understanding their true costs of care. So being able to provide consumers with better information up front should not only improve how they manage their expenses, but how they manage their long-term health and outcomes.